The most important thing I can tell you is there's hope. Let me take just a second and discuss a little bit of the science of migraines. The first thing to understand is that migraines are an underlying seizure disorder. This isn't commonly talked about, but because they're a seizure disorder, how the seizure comes to be and what happens after is very important. And in fact, those things are unique to each person who experiences migraines. Now, there is in the middle a time point that's semi-common amongst most that experience migraines. And that is when the hypothalamus, a part right in the middle of the brain, and the fifth cranial nerve in the brainstem are both experiencing a seizure simultaneously. These two brain regions produce many of the symptoms and difficulties that arise from migraines, including things like difficulty with memory, difficulty with cognition, muddled thought. The pain itself comes from these changes, and the changes are so varied and unique to each individual that we have to dig a little bit deeper to understand what in your particular case would be causing this to happen. The next steps are to start to figure out what has led to that seizure disorder, and then what effects has that caused in your brain. Let me take a minute to acknowledge that your road so far with migraines has probably been a little difficult. We understand that you've probably sought care in multiple places and tried many things, and it's probably been a very frustrating experience. We are dedicated at the Migraine and Neuro Rehab Center to doing in-depth, significant diagnostics. We will not prescribe any care until we've understood very specifically your case. There are no cookie-cutter treatment plans at the Migraine and Neuro Rehab Center. Everyone's experience with migraines is unique and needs to be treated as such. We invite you to meet with one of our migraine specialists so we can help you take the next steps towards healing.